name is Lesley and I'm from Saudi Arabia. I'm a rehab physician since 1998. Studying medicine made me think that we are in a profession that helps people. And helping people is never by knowing the number of the medical record, knowing the first name or the last name and utilize it in whatever services. Cough, let's take a cough syrup. Surgery, do it and get out of here. That's not helping. I believe helping is a quality before it's a quantity, and this quality is provided by rehabilitation. That's first of all. Second things, once I got into rehab made me think that people deserve more. Disability is not a disease. Yes, it needs the help of a doctor to regain a member of the society into the working field and working society. We don't need to lose people with disability. Unfortunately, in my country, disabled people were unfortunate for years. Although the bylaw now has more or less got into their favor and trying to help them financially and socially and vocationally, yet this is very minor effort. So once I started rehab, I always wanted to be part of this task force that allow us to help these people as much as we can. First, by educating the people, the patient, the doctors, the medical field, the people, the partners, the families. The second thing is to make these patients get the best out of what they have. Whatever they can do, let them do it optimally. And that's why I loved rehab. I know my patients for the last 10, 12 years. I'm proud to say that the number of my patients which I changed their life, and I mean changed their life, or at least I helped in changing their life to the better situation, makes me so proud that I got into medicine to start with. So basically that's what is it for me. Rehab is improving the quality of life of people, helping people as much as they can, and probably and hopefully, and that's what I'm working on, improving the disabled people condition in Saudi Arabia. Rehabilitation situation in Saudi Arabia, I have to say, it's still in its crawling phase. All in all, the Saudi doctors, the rehab Saudi doctors, we're not more than 10 at the moment. In the population of 22 millions. And out of these 22 millions, you're talking about at least 20 to 30% of RTAs annually that leads to disability at a certain level. So basically we need still hundreds and hundreds and hundreds of rehab doctors. Fortunately, we've reached a stage that our king now, King Abdullah, God bless him, has really supported rehab and gave his recommendation to start 40 centers in Saudi Arabia by 2012. And he allocated enormous budgets just to do this field because we have a lot of people that deserve the attention and deserve the care. And because of his knowledge and his support, we've started lots of centers in Riyadh, in Jeddah, and Khubar, that's where I belong. And that's where we've started a lot of private and public centers for disabled people, and starting from young age as pediatrics till adults. I was the first female when I started at Riyadh Military Hospital. My colleagues were all male, my boss was a male, and at the beginning I felt privileged because I was more or less spoiled between my colleagues to choose and pick the cases that I take. After a while, especially with the increasing number of disabled women, I was more seeing those women because of the cultural differences, the women prefer a woman. But then I found that my patients, whether they are male or female, they would just prefer the way you deal with them. And that's where I looked into the situation and said, you know what, as long as you're providing a good service, it doesn't matter if you're a male or a female. If you know how to respect your patient and their families, they will just support you. And against all my expectations, but culturally, actually I was loved and really cooperated with a lot of patients from villages and from underserved areas. And that was great. And that was great. And they accepted me just the way I am because I provided the service which they felt it was not there before. When I was at Riyadh Military Hospital at the beginning, Riyadh Military Hospital is a tertiary hospital that supports all the kingdom as a rehab department. So we used to have people coming over to our hospital, referred from all over the kingdom, especially if they are affiliated to the military services. Then, after I finished my residency in Australia and I came back to join King Fahd Specialist Hospital. And there, that's in Dammam, in the Eastern Province. Basically, it's in the area where all, or I wouldn't say all, but 80% of the area around it, it is underserved, more or less, especially in this field. We were the only hospital actually in the area, in the Eastern Province, that provided rehab services for the patients as in public sector. In the private sector, there was a hospital or two. One of them is the hospital I'm working now on, is Al-Zahra Hospital. But this is all still a very premature, very young steps, but we're working to make them stronger and to be supported. I don't know much about Yemen. I cannot really talk about it, but I know in Bahrain, they don't have a rehab doctor. They have some physiotherapists who are doing the rehab services, and they come more often to Saudi Arabia or outside Bahrain in general for rehabilitation. In Qatar, there is about 1 or 2 doctors. I think one of them, she's still in Sweden doing her residency. I don't know if she finished, but they are starting to start the rehab services. In Emirates, still it's very premature. And unfortunately, it's not really, the people are not fully aware of the importance of the specialty. So that's why I think it's still premature steps. So among the Gulf area, I think in Saudi Arabia, we did the greatest step. In Kuwait, there is a sports hospital, and there is a few rehab doctors, but still, the medical situation in Kuwait is not that supportive. I think in Saudi Arabia, we advanced because we started early, and we had the support of the Ministry of Youth at the beginning. And then we had the support of the King in the last 5-6 years. And the support of the King gave us a great privileges. Allocation budget, allocation space, allocation of hospitals, trying to educate staff, sponsor them for further education. That all made the difference, I think. I first came to know about International Rehab Foundation on about 2 years ago. That was in 2009, and that was the year that we went to our meeting in Kayseri, Turkey. And I was fortunate to meet the people in the International Rehab Forum, and from there, the discussion showed that how similar cultures in undeveloped area, or I wouldn't say underdeveloped, but less developed areas in the world, those experiences have helped us to grow our experience and to strengthen it and to find where is the deficient points that we need to work on. Besides that, it gives you a chance to broaden your horizon and don't just focus on what you're doing now, but you can help others with that minor efforts that you have. And although I thought that in Saudi Arabia we were unfortunate and we were less serviced and yet when looking to the rest of the world, some of the area with the disasters areas or really undeveloped, they didn't have the basic medical support. And I guess, you know, we passed that stage. So seriously, you think that you want to help these people and you want to provide whatever knowledge, services, free services, do rotations. And I think this foundation has helped us to get together, share experience, share expertise, and hopefully that we're working on more and more to enjoy this cooperation between all of us. And whoever is fortunate in one field, whether it's financial, scientific, experience, also would help the other party who are unfortunate to have that expertise or that deficient. I have to mention my patient Ali. He is a 16-year-old boy who had a proximal myopathy and more or less a very, very minimal kind of cerebral palsy, which caused him to be paraplegic, not paraplegic. Yet, he was unfortunate. He didn't find any rehab services for the last at least 6-7 years when I saw him. So since he was 8 or 9. That was the last time he saw, more or less, I wouldn't say a rehab doctor, but somebody that even looked at his wheelchair and assist him for a new wheelchair. And he was stuck at home with a domestic help that changed his diapers. He didn't even have him on catheters. He stopped going to school because he grew up and he felt embarrassed. And it was really something breaks your heart. It really breaks your heart. Such a young guy, such an intelligent guy. And he was just so embarrassed with his situation just to go even back to school. So actually, the nice thing that he came to my clinic, that was on the year of 2008, April 2008. And I saw him, I assessed him, I assessed whatever needed to be done for him, all the basics of rehab, plus his wheelchair, the other instrumentation which helped him at home. And exactly it was February 2009. I was on vacation and I came back from vacation, and once I stepped on the stairs of the hospital, there's this young gentleman who's standing with one stick by the stair and saying, "Dr. Lesley, how are you?" And I look and I was like, "Do I know you?" And he's like, "I'm Ali." I said, I can't believe it. It just took my breath away. I mean, the guy was already standing after exactly 8 months of rehabilitation. And he told me that he already finished with the diaper. He was independent in his personal hygiene. He went back to school. And he finished one term already. And he passed it. And the wheelchair was out of the picture. The patient was independent. He didn't even need the domestic help. And he was coming for a follow-up in the clinic with no support. Nobody, no his father, no help, nothing, by himself. I mean, this moment, just seeing him standing there, it makes all the medicine, all the effort, all the trial of working hard, makes it worth it.